Hello, I'm Dr. Rajeev Pullagura, surgeon and podiatrist. Many wounds don't become serious only because of wounds itself. They become serious because of wrong dressing, delay, and home remedies. If you have a surgical wound, diabetic wound, injury wound, boil, abscess wound, ulcer, or if you are changing dressing at home, please watch this carefully because one mistake in wound dressing can delay healing and sometimes increase the infection. Many patients think wound dressing means simply covering the wound with a cotton, cloth, or a bandage, but actually, dressing is a part of the treatment. If wound dressing is done wrongly, even a small wound can become painful, infected, and become a very slowly healing wound. Sometimes the patient removes the dressing, checks the wounds again and again, touches it with the finger, presses it to see if any pus or any fluid is coming out, and then covers it back again. Please understand, our hands may look very clean, but germs are present on the skin. When we touch the wound directly with the unwashed hands, germs can either enter inside and infection can increase. Before touching the wound dressing, wash your hands properly with soap and water or cleaned as per the advice of your doctor. Another mistake is using a dirty cloth, old bandages, reusing the same dressing material again and again. Some people remove the bandage, keep it aside, use it again because they feel it is still okay. But once a dressing is removed, it can collect germs, dust, sweat, discharge. Reusing it puts infection back into the wound. A wound needs to have a clean dressing material, not a random cloth or a reused bandage. Many patients also apply home remedies on wounds. They apply turmeric, coffee powder, toothpaste, oils, herbal paste, sometimes even ash and some random creams suggested by someone in your family. I understand families do this with a good intention, but are things that can irritate the wound, bring germs, block proper healing, and sometimes make the infection worse. Please do not apply any home remedies or medicines without a proper advice or opinion. Another important mistake is using antibiotic ointments, antiseptic liquids, or creams repeatedly without a doctor's advice. Some people keep applying strong antiseptic liquids again and again, thinking the wound will heal faster. But these chemicals and products can irritate the skin, damage healthy healing tissue, and cause delay in wound healing. So please do not use random ointments, antiseptics, antibiotics, or other home remedies repeatedly without medical guidance. Some patients keep the wound open thinking air will heal it faster. Though it may be true in some cases, doctors may advise you to keep the wound open, but doing so yourself is risky. If the wound is exposed to dust, sweat, clothes, insects, or sometimes even dirty surroundings, germs can easily enter and infect the wound. On the other side, dressing should be done in the correct way depending on the wound type, the size, how much of discharge it is throwing, and based on the infection status. Another common problem is changing the dressing too often or not changing it for many days. Some people change it every few hours because they are very anxious. Oh, my wound is healing or not. They want to take a look. They keep removing the bandage, checking the wound again and again. This also disturbs the healing process and as well as increases the pain during dressing. Some other patients keep the dressing for many days even if it becomes wet, dirty, stinky. This also causes increase in infection. Dressing frequently depends on the wound. So follow the given schedule by your doctor and not some random advice. One painful mistake is pulling the dressing forcefully when it is stuck to the wound. When the dressing sticks to the wound, many people pull it quickly, telling that, okay, probably the pain may come down. This causes tear and new healing. If a wet dressing is stuck, don't forcefully remove it. It needs to be softened either with boiled water that is cooled down or with something called as normal saline and removed carefully in a proper way. If you are not sure, visit a clinic or a doctor and get it changed safely. Now, I want to mention one more important point about cotton. Many patients use loose cotton directly on the wound. They think cotton is soft, so it is safe. But loose cotton fibers stick to the wound surface. And when you remove it, those fibers can pull the healing tissue, cause pain, irritation, and bleeding, as well as they get stuck or embedded in the wound itself. Dressing material should be used properly, and material touching the wound should be selected based on the wound condition. So simply don't use stuff like cotton directly onto wound or place a loose cotton directly over it. So what should you do instead? First, always wash your hands before touching the dressing. Use a clean dressing material. Change the dressing as advised by your doctor. Keep the wound dry if your doctor has told you to keep it dry. Do not apply any cream, powder, oil, antiseptic or other home remedies without the advice. Do not keep checking the wound again and again unnecessarily, and most importantly, go for a regular follow-up of your wounds. For diabetics, this is even more important. If you have diabetes, wound healing can become slower. High blood sugars can reduce the body's ability to fight infection. Even a small wound can become a serious wound if ignored. Please do not wait for pain. Some diabetic patients may not feel pain properly due to the nerve weakness, something called as neuropathy. If you have diabetes and you notice a leg wound or on the toe or on the heel, get it assessed and checked properly. Now, when should you consult a doctor urgently? If there is redness surrounding the wound or the wound is increasing, if the discharge in the wound is there, if the swelling is increasing, pain is becoming more, pus discharge, bad smell, fever, black skin around the wound, stitches are opening up, or wound is not healing after many days also. Please do not delay. Please reach out to your doctor at the earliest. Sometimes the wound may need a proper cleaning, drainage of pus, change in the dressing method, and sugar control, antibiotics if required, or further treatment. But the problem starts when the patient keeps guessing at home, changing random dressing, applying internet remedies, or waiting too long. Wound healing needs the right environment. If you or someone in your family has a wound that is not healing, has pus, pain, bad smell, swelling, or it is related to diabetes, please do not keep repeatedly changing random dressings at home. Visit a doctor for a proper wound assessment and treatment. So remember, wound dressing is not just bandage, it is a part of your treatment. Clean hands, correct dressing, proper follow-up, good sugar control, and good food avoiding home remedies can protect you from infection and delayed wound healing. If your wound is painful, smelling, discharging pus, becoming bigger, or not healing, don't wait. Get it checked early. Early care can prevent bigger problems and help your wound heal safely. I hope this video was useful. In case you have any wounds, kindly go through the same. You can share it to people who may require this information. And if you like the video, kindly share, subscribe, and like the channel. Thank you.